Hello, it's Bruce Williams, and today I want to present Part 7 of my series on the selected gross pathology of avian species. Part 7 is going to cover briefly the endocrine system, and then we're going to talk about a number of diseases affecting the nervous system of poultry and pet birds. As I do at the beginning of all of my lectures, I want to thank my friends and colleagues who provided me images over the years, either directly or through online collections, which allow me to put these lectures together. Starting with the endocrine system, here's a huge pair of thyroid glands. Birds don't get a lot of thyroid tumors, and we have bilateral enlargement, so I would imagine the top of your list should be thyroid hyperplasia or goiter, which has been identified in a number of bird species. While goiter may be induced by either a deficiency or an excess of iodine, it's usually the result of iodine deficiency by feeding your bird something that is going to bind up iodine, the so-called goitrogenic agents. There are a number of these within the brassica family, including broccoli, turnips, cabbage, kale, and rapeseed. And there have been a number of incidences where people were feeding, especially psittacine birds and parakeets, too much broccoli, inducing thyroid goiters. There are a couple of other things that may result in enlarged thyroids, including inflammation as a result of septicemic disease, which may rarely cause hyperplasia, and a couple of chemicals, including organophosphates and chlorinated bipheноls, which have been incriminated in the literature over the years. The abnormal function of thyroid glands and their increase in size may result in a number of clinical signs associated with this, including the mechanical pressure that you can see on neighboring body organs, such as the esophagus, trachea, or the large branches of the aorta. When they press on the esophagus, the animals may regurgitate. When they press on the blood vessels, the animals may develop convulsions and sudden death. And when they press on the trachea, the animals may have trouble breathing, or you may note a change in their voice. The thyroid is involved in many of the metabolic functions in the animal's body. So you may see an association with goiter immunosuppression, and the birds will easily develop infections. You may see depression and lethargy as a result of the metabolic rate of these birds being decreased. And you may see problems in other systems, including abnormalities of skin and feathers, and reproductive problems, including decreased hatchability and increased embryo mortality. In pet birds, look for dietary problems, including vitamin deficiencies or mineral deficiencies of other types, because sometimes these animals are not being supplemented properly, and especially look very carefully at what the owner is feeding, especially if it's feeding a lot of green leafy vegetables. Right next to the thyroid glands, and these are a little bit more normal looking thyroid glands, are the parathyroid glands. Yes, birds have them too, and these are very big. This is parathyroid hyperplasia, and when you see that, you want to think about a couple of things, and that is usually abnormalities or deficiency of calcium or vitamin D. Now, this might also be a physiologic finding. We'll start there because you will see parathyroid hyperplasia in hens which are in lay. These birds have to transfer about 1 gram of calcium each day, which they take out of the bones and they put in the eggshells. Okay, so obviously they have to be supplemented with calcium and vitamin D to make sure that they're absorbing enough calcium. And one thing that you'll see if they're not being supplemented, and even sometimes if they are being supplemented, is that the bones will be soft. Calcium has to come out of the bones will be soft and somewhat brittle. If they're not being supplemented, you can experience fractures or abnormally shaped bones in these animals. You'll see this in animals not in layer or broilers who are deficient in calcium or vitamin D. And you'll see this concurrently with fibrous osteodystrophy of the bones, or a lack of mineral in the bones. Will be soft, brittle, easily broken. You may see fractures, or in growing animals, they will be abnormally shaped, and you'll see rickets. The legs will be bowed, the keel bone will assume an abnormal shape. An uncommon cause, but still a cause, would be older animals, especially pet birds, with chronic renal disease. They may be associated in captive birds of prey, like raptors, who are fed a very high meat diet. Some of the diets that you see, when normal avian diet should be, the ratio of calcium to phosphorus for avian diet should be about 1.5 to 1. Sometimes these animals have such a steady diet of meat. Remember that they normally eat the entire prey, and there's a lot of other things in there, but if they're just being fed chunks of meat, it can range up from 1 to 17 to over 1 to 40. And it's going to cause some major abnormalities in the calcium-phosphorus ratio. So you can get parathyroid hyperplasia and fibrous osteodystrophy, or easily fractured bones, in these abnormally fed birds of prey. There is also a correlation in the literature with a drug called omeprazole, which is a anti-acid, which may be fed to stressed animals, which may cause parathyroid hyperplasia. Pituitary tumors, including adenomas and carcinomas, may be seen not uncommonly in psittacine birds, especially cockatiels and parakeets. Usually these are not diagnosed with any tests. They're diagnosed by neurologic signs and then confirmed at autopsy. So birds will get pituitary adenomas and carcinomas as well. Okay, let's move on to the nervous system. A couple of normal things. Here's a black brain, or at least the meninges are black, and I think it probably extends down into parenchyma a little bit. And this is commonly seen in a number of animal species. This is melanosis. It's just a pigmentation. It doesn't cause any problems. You can have pigment deposition within the meninges, within the brain parenchyma. Heck, you can have pigment within just about any organ. And some of the very darkly pigmented breeds of chickens will have this very commonly. This is an Araucana hen. I hope I'm pronouncing that correctly. It's a type of chicken from South America that has this a lot, and it lays robin's egg blue eggs. Or robin's egg blue, that's silly, but it's brightly colored blue eggs. Okay, here's another normal finding in poultry, and most people never split the lumbosacral spine, so they may not see it. But can you see this sort of clear area sitting initially dorsal to the lumbosacral spinal cord? This is known as the glycogen body, and it's a unique feature of the avian spinal cord. It's a large aggregate of glycogen, which sits there, and even if the bird is starving, does not seem to decrease in size. The role of this organ in glycogen metabolism is still obscure, and glycogen bodies have been in birds and their predecessors for a long time, and this particular organ possibly have given rise to the old myth that some of the less intelligent dinosaurs, like Stegosaurus, required a second brain in the area of their back legs to power their back legs. And it's thought that this might have been what these early paleontologists were looking at, rather than the presence of a second brain. And here's another picture from John Sagartz during his time at Ohio State University, which shows you the glycogen body of the avian spinal cord. Okay, So we're going to look at a number of agents, especially viral agents, that cause various forms of neurologic disease. And here is a couple of chicks that have obviously seen better days, unable to stand, ataxic, and if we were watching them, you would see that they have a very rapid tremor of the head and neck. This is a condition which is caused by a hepatovirus of the Picornaviridae family, which was first identified in 1932 and was called epidemic tremor. Nowadays it's called Avian Encephalomyelitis. The tremors worsen when the chicks are excited, and they disappear when they go to sleep. It's not only disease of chickens, also can be seen in turkeys and quails as well. And when you see it, the outbreaks generally occur in young birds less than 6 weeks of age, and they initially develop ataxia, and they progress to either paralysis or this tremor of the head and neck. The earlier the animals are infected after hatching, the more severe the signs. And adult birds may show absolutely no signs except for maybe a drop in egg production. There aren't a lot of gross signs which are associated with this particular condition. The lesions are mostly histologic, and chromatolysis of neurons in the brainstem and Purkinje cells predominates, but you might also see a lymphoplasmacytic encephalomyelitis and ganglionitis of the dorsal root ganglia. There are a couple of gross lesions which are peculiar to this disease, which include multifocal white nodules within the proventriculus. And these are areas of marked infiltration of lymphocytes and plasma cells, something that, you probably also want to consider a lot of the lymphocytic tumors we've talked about, including Merrick's disease and lymphoid leukosis. But this particular lesion is somewhat characteristic and has been associated with avian encephalomyelitis. Another unique lesion to this is the formation of cataracts. Now, birds can develop cataracts on their own, but birds that have recovered or were mildly infected with this picornavirus may develop lesions within the lens. Okay, let's go back to a viral disease that we've already talked about in a number of these lectures, including a fairly lengthy discussion in lecture number 3, diseases of the hematopoietic system. And we said one of the characteristic positions that you can see, and it's not specific to this disease, but this is the hurdling chicken. It has one leg stretched out and it's sort of dragging itself along with that, and the other one is paralyzed. And this is one of the neurologic manifestations of Merrick's disease. When you have infiltration of the sciatic nerve by the neoplastic lymphocytes, you will get paralysis on one side or paralysis on both sides, and they would sort of just be laying there. And this would be the gross lesion that you would expect would be this thickening of the sciatic nerves. It could be, as we said before, unilaterally or bilaterally by infiltration of the neoplastic lymphocytes, which have been turned on by gallid herpes virus 2, a gamma herpes virus that causes a neoplastic proliferation of T cells and lesions throughout the body. If you thought that the hurdling chicken was funny, then here's another chicken with Merrick's disease exhibiting a form of torticollis. We're sort of peeking at us from underneath its abdomen. Okay, so this is Merrick's disease as well. But a lot of different neurologic diseases can cause this form of torticollis or even other bizarre looking appearances. So if I look at this one, I'm going to think of everything from viscertropic velogenic Newcastle disease, maybe avian encephalitis. We're going to look at a number of vitamin deficiencies. So, except for maybe the hurdling chicken, and we're going to look at curly toe paralysis. There aren't a lot of really classic neurologic positions, but it's sort of fun to look at these funky chickens. Oh, we were talking about Merrick's disease. I'm sorry, I just had to interrupt and take a long phone call, so I lost my train of thought. But other things that you can see in the nervous system with Merrick's disease, and remember the eye is an extension of the nervous system, so we're going to cover some eye diseases here too. And you have this constricted pupil in a gray iris, and this is known as gray eye, and it is also an occasionally seen manifestation of Merrick's disease when the iris is infiltrated by so many of these neoplastic lymphocytes that the color is changed, the iris swells and encroaches on the pupillary space. And this is gray eye, another neurologic / ophthalmologic manifestation of gallid herpes virus 2 infection. Okay, we are looking at a viral disease, and there is multifocal hemorrhage of the meninges, which extends down into the brain itself. There's some hemorrhages on the cerebellum, and I'm going to tell you that this is a crow, and there's something that I want you to think about when you think about crows, and you can see this in other species as well, but this is the type of lesion that you may see in association with West Nile virus. This virus was first identified in northeastern U.S. in 1999 by Dr. Tracy McNamara, who's working at the Bronx Zoo. And when everyone was pointing to other viral encephalitides, she was able to identify this as West Nile virus. And it's an arbovirus that causes fatal disease in a number of species, including birds, horses, humans, and some other mammalian and reptilian species. Now, birds are the reservoir for transmission. Humans and horses and all the other ones are basically dead-end hosts. That's sort of a pun because they can cause fatal infections in these hosts, but they do not, as dead-end hosts, they do not further the life cycle of the virus. It's transmitted by mosquitoes, although other forms of arthropods, including ticks, are able to harbor the virus, but probably not transmit it. West Nile virus infects a lot of different tissues of the body, and in these bird hosts, especially crows or corvid birds, it would be faster to name the tissues it does not infect because it's just absolutely widespread. Almost every tissue in the body is going to have viral antigen. They do cellular targets include the central nervous system, especially cerebellum, and macrophage dysfunction. Macrophages are a big target of this virus. Contributes to release of a lot of inflammatory mediators, which result in sort of a disseminated intravascular coagulation in these bird hosts. Doesn't appear to target endothelial cells. That might be the only tissue that it doesn't go after. You would expect these animals to have ataxia, recumbency, abnormal head postures, or you can see sudden death. And you will see literally lesions throughout the animal with hemorrhages and encephalitis in the brain and the cerebellum. You'll see splenomegaly, hepatitis, myocardial hemorrhage with degeneration and necrosis. You can see enteritis. So in bird species, West Nile is and especially corvids, the crows and related species, severely affected, and you can see it in a number of other bird species as well, including cranes. I don't think that there's any type of avian species that's probably resistant, but certainly crows and ravens are the ones that are especially hard hit. Okay, here's a lesion, an area of infarction and necrosis in the cerebellum, we're moving on from viral disease to fungal diseases. And this is a fungus that causes what used to be known as Episodic Encephalitis in young chickens and turkeys. And a lot of times the young birds will pick up the fungus from infected litter in brooders. And so you see it in young chicks. And this is one that is sort of particular for poultry. It used to be called Dactylaria gallopavum. Now it's Acroconus gallopava. It's a sort of weakly pigmented fungus. And the pigmented fungi can cause disseminated infection or subcutaneous infection in a number of animal species, including cats and horses, but they tend to cause encephalitis in birds. The animals will have the neurologic signs that we keep saying over and over: this torticollis or abnormal posturing, incoordination, muscle tremors. And you can also see rarely respiratory disease or blindness in these animals. Usually the lesions are pretty well demarcated areas of necrosis in the cerebellum, or you can see them in the cerebrum as well. You certainly have to think about Aspergillus, another fungus that will cause an identical lesion in very young poultry in chicks, and would look identical grossly. And here's a very similar picture. Here is areas of white which are extending into the brain parenchyma. I would think about Ochroconus and Aspergillus. Another possibility, let's not forget about cholesepticemia. Remember fibrin in potential spaces like the joints, the coelom, and the meninges. So these sort of whitish plaques. I'm also going to think in the back of my head a little bit about cholesepticemia as well, which can cause a meningitis. Well, here's a flat duck. And this duck has been infected with Clostridium botulinum, and so has flaccid paralysis, is not long for the world, may die of respiratory paralysis. Botulinum. Well, that was weird. Okay, botulinum toxin is one of the most potent natural toxins known, and it's a neurotoxin. It has affinity for the motor neuron, and after absorption of the toxin, it's going to bind irreversibly to the presynaptic membranes of the cholinergic nerve terminals, and it blocks the release after it enters the neuron of acetylcholine, resulting in a flaccid paralysis of these animals. The paralysis usually starts in the legs and then moves forward over the animal to affect the wings, the neck, ultimately the eyelids, and the animals will die of a combination of respiratory muscle paralysis and cardiac dysfunction. There are a number of toxins, A through E, and outbreaks in waterfowl and poultry are usually the type C toxin, although you can see type A toxin in poultries. And type E toxin is predominantly the one that's seen in fish-eating birds, such as gulls and herons. Now, Clostridium botulinum is a ubiquitous spore-forming gram-positive rod, which is present everywhere in soil and freshwater lakes. And it tends to bloom when the heat goes up. So most of the outbreaks that we see in waterfowl occur during the summer and fall. And when these outbreaks generally follow a certain pattern where you have a small number of birds which die. If you've ever dealt with these outbreaks, they float around, they get infested with maggots, and something that ducks like is they like those little maggots, and they like to eat maggots, but the maggots and other invertebrates that the ducks have access to have been concentrating the toxin. Doesn't seem to affect them, but then the ducks will eat them. In these poison ducks, you will often find maggots within the crop, and so these outbreaks can grow and grow. The cadavers of the dead birds also provide the anaerobic conditions that are required for the optimal growth of Clostridium botulinum. Here's a paralyzed bird. Looks like it's casting a magic spell, but actually you can see that the neck is paralyzed, as is the rest of the bird. So gives, this is why the disease has been called limber neck in bird species, especially ducks. Okay, a bunch of crazy looking chicks here, and that's because they have crazy chicks disease. These are young turkey poults, which have encephalomyelitis arising from a dietary deficiency of vitamin E. Vitamin E or selenium deficiency is most famous for this particular condition, but it can also cause a number of other conditions in association with selective deficiencies of other minerals or amino acids. It can cause exudative diathesis with concomitant selenium deficiency, nutritional myopathy with concurrent sulfur amino acid deficiencies. Vitamin E deficiency will also cause reproductive problems in older birds. Vitamin E is a potent antioxidant, and when you have deficiency, especially if you have high levels of fat, unsaturated fat within the diet, you tend to burn it up very quickly. And you have a loss of antioxidant protection, and then you have the formation of free radicals and hydroperoxides within lipids, within lipid membranes. Remember that every cell has a lipid bilayer, every organelle is surrounded by lipid. So the potential interaction between these free radicals and cellular membranes gives rise to some very devastating diseases. The encephalomyelitis, the scientific term for crazy chick disease resulting from vitamin E in turkeys, usually is seen in animals less than a month of age. Could be up to 2 months, but usually they're less than a month of age, and there's an acute onset of all the signs we've seen before: ataxia, muscular weakness, tremor, abnormal posturing, including torticollis or stargazing. And the lesion that is so characteristic of this is hemorrhage within the cerebellum, the so-called Bing cherry cerebellum, because the lack of vitamin E causes damage to endothelium and resulting hemorrhage and thrombosis, especially in the cerebellum, but you can also see hemorrhage and thrombosis within the cerebrum as well, and all the clinical signs that we see in these animals are the result of that. Very classic lesion for encephalomyelitis. Not a great name for a disease, much better a name for a morphologic diagnosis, but encephalomyelitis in turkey poults. Oh, here's some good-looking birds, got bright red bow ties on, but the thing that you'll notice about this is they're sitting on their hocks, and their toes are curled. And this disease has gone by the name of curly toe paralysis since time immemorial, and it is a deficiency of vitamin B2, also known as riboflavin deficiency. Need to get a cup of coffee here. Guarantee I will never edit out these little flubs. So, what you see with riboflavin deficiency is generally disease affecting the sciatic nerve. It is a disease which is initially characterized by edema and separation of the nerve fibers. Over time, you get demyelination of the sciatic nerve, the nerves that come off of that, and some of the other peripheral nerve trunks. And you can, as a secondary, after significant demyelination, result in actual damage to the axons. In older birds, you will see a decrease in egg production, and riboflavin deficient embryos will not hatch. And here is another case of curly toe paralysis by Dr. Federico Giannini. But wait, this isn't curly toe paralysis. This is a case of Merrick's disease. Remember, in Merrick's disease, the neoplastic lymphocytes infiltrate that sciatic nerve, giving us almost the identical lesion. So the lesion that we see with riboflavin is characteristic of sciatic nerve degeneration, not a particular cause. So when you see that, like we've seen before, a lot of these neurologic postures may be a number of things. You have to have a good differential diagnosis. So when you see these curly toes, I just want you to think of something that's affecting those sciatic nerves, and it could be riboflavin or it could be Merrick's disease as well. More crazy clinical pictures of birds, and this is another type of vitamin deficiency and a very characteristic position of a chick with thiamine deficiency. Thiamine deficiency also causes a polyneuritis. They could get those curly toes as well. The stargazing posture has been identified with this particular condition due to paralysis of the anterior muscles of the neck. So these are paralyzed, and when these contract, that head flips over backwards. You may see this sign about 3 weeks after they're fed a thiamine deficient diet, and soon after this, the animals will lose the ability to stand or sit upright and flop around like this one here on the left. Ultimately, they're going to show severe anorexia. They lose all interest in feed, even if they were able to eat it. And you're going to lose them unless you start supplementing with thiamine again. This is most often seen, as in mammals, when poorly processed fish meals are used as a significant component of the diet because fish contains an enzyme which breaks down thiamine. Remember that the lesions associated with thiamine in herbivores are going to be very different in the brain. It's going to cause a laminar necrosis in the cortex, which is the superficial gray matter right underneath the meninges in the cerebrum. And then in carnivores, it's going to be even another distribution of lesions within the brain, affecting paraventricular nuclei and the caudal colliculi of the cerebellum. So 3 different histologic lesions in 3 different groups of animals, all due to thiamine deficiency. Okay, let's move on to a couple of eye diseases. This is bacterial ophthalmitis. You can see that there is pus in the anterior chamber, and this indicates, when you see hypopyon, it indicates, at least in birds, bacterial septicemia is considered to be a sterile inflammatory change in people, but in a lot of animal species, it's associated with gram-negative sepsis, and it certainly is in the bird. This may be one of the signs associated with E. coli, colibacillosis, or cholisepticemia. We've talked about that. And what happens over time is that this eye will eventually become contracted, destroyed, and the animal will have a very small eye there. Another great example of terminal ophthalmitis due to gram-negative septicemia is seen in turkey poults. This animal has what's known as wry eye. It looks like a very wise bird, or maybe a bird that is sort of flirting with us, maybe giving us a little wink here, but actually the eyelids are starting to come together because the eye itself has been bacterial infected and is starting to degenerate and shrink down. The animal eventually is probably this time is blind in the eye, and ultimately it's going to have sort of microophthalmia as a result of end-stage ophthalmitis. This particular agent in turkeys is well known. It is a highly host-adapted form of salmonella called Salmonella enterica variant Arizonae. It's been well known to be a problem in turkey poults, And it also can be a problem in reptiles, especially snakes, where it causes vertebral abscesses, and very rarely will get into immunosuppressed people who are handling reptiles and become infected. But Salmonella arizona is a classic pathogen of turkey poults, can cause high mortality as a result of septicemia, and in surviving animals gives you the wry, W-R-Y, wry eye appearance. Just a little fun here. Here are two bird brains, and this one has very prominent optic nerves. You know, birds are very visual creatures, and so if an animal really uses its eyes, it's going to have big optic nerves. If it doesn't use them much, like naked mole rats or whatever, they're going to be very small. Now here's one where you have two different sizes, and this is from an animal that had ocular damage. It could have been due to a bacterial infection, could have been due to a long-standing cataract or something. But you can see the difference in size of the optic nerves means that there has not been a lot of impulse. There is atrophy on the side of the damaged eye. This is a little fun fact. Hey, I think we're almost done. I don't have a lot of eye diseases in birds. This is one that we have already looked at one point, but this is a house finch. And one of the diseases that finches get, and something that they will spread in the wild to finches and sparrows on the eastern coast and the Midwest over the last 20 years, has gained significant prominence, is Mycoplasma gallisepticum. Causes a lymphocytic conjunctivitis, in addition to respiratory conditions, but you can get a severe conjunctivitis, and ophthalmized animals will be unable to see or find food. They will starve to death, and then the ones that are mildly infected will sit at the feeders and rub the mycoplasma all over to infect the other animals. It is considered to be a significant disease, initially released into the wild through pet finches, and now it has spread within finches and related bird species. Okay, well, that brings us to the end of this particular lecture. Hope you come back for lecture number 8. We're going to talk about the integumentary system of birds. I hope you got something out of this particular lecture, at least the fact that if you see a funny position on a chick or turkey poult, don't automatically jump to any particular disease. Like a lot of these avian diseases, a good differential diagnosis is required. Okay, I hope everyone has a fantastic day, and I'll see you later on the Foundation's Facebook page and YouTube channel.